Welcome. Thank you for joining us today. I'm Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is a special partnership between the Blum Center and the MGH Sexual Health Clinic. Before I get started, I just want to go through items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has music and here are guest speakers today. If you have any comments or questions you'd like to share, feel free to do so in the chat box, which is located at the bottom of the screen. We'll have time from the end. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask a doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which I'd like to ask you to complete. Your feedback is important to us as we plan future programs. So in recognition of STI Awareness Week, we have members of the MGH Sexual Health Clinic, Daniel Worrall and Eric DeCory, who will be leading today's session. So next, I'm going to turn over to Eric, who will get us all started.
Thank you so much, Amy, and thank you all who are joining. I hope to one day meet you in person someday very soon. As Amy said, happy STI Awareness Week. Really honored to be with my colleague Daniel to talk about what STI Awareness Week is all about, break down some common myths. Let's talk about some STIs, answer some questions from all of you. Before we get into everything we're going to talk about, I'd love Daniel to introduce himself.
Hi, everyone. I'm Daniel Worrall. I work as a nurse practitioner in the Sexual Health Clinic. I've spent a lot of my career working in sexually transmitted infections and other areas of medicine that involve sexual health. So I'm very happy to be here to answer some questions.
And really quickly, my name is Eric DeCory. I am the Community Engagement Coordinator for the Sexual Health Clinic. It's my job to go out, talk about the Sexual Health Clinic, raise awareness that we exist, provide education, and go into community and find community partners. So let's get into it. Before we even start this conversation, if STI Awareness Week could be a movie title, what would it be?
Ooh, I think something like I Wonder If I Take You Home, and have this be more of a musical and have it highlight things like herpes, syphilis, other things that are interesting to people to learn about. So
I love
something Timothy Chalamet might star in.
I love a good musical too. So we'll have to write. We can compose after this. So I think when it comes to STIs or sexual health, there's a lot of myths that are out there, and I think that's one reason folks lean into certain things. I think there's a lot of false information out there, whether it be TikTok, Instagram. There's also some truth, but let's break down some common myths.
Sure.
So can you get an STI from a toilet seat?
Definitely not. So as much as people would like to believe that toilet seats are a source of sexually transmitted infections, you actually would have to have oral sex, anal sex, vaginal sex, or at least skin-on-skin contact for some sexually transmitted infections.
And another one, to channel Blanche Devereaux from the Golden Girls, people, I think only promiscuous people get STIs.
So that's absolutely not true. I like to think of sexually transmitted infections as a roulette wheel of misfortune, where if you think about this, you could spin that wheel 200 times and never hit a bankruptcy slot, or you could spin it once and unfortunately hit a bankruptcy slot and get chlamydia.
Well, this kind of goes into the next, myth. I would know if I had something.
So a lot of sexually transmitted infections don't have symptoms, so you might not know that you have something. It takes some of these infections a lot of time, like sometimes days to weeks to even months to manifest. So you might have something and just not know, and that's why testing is important.
And another one is, can you get a STI from oral sex?
So you absolutely can get an infection from oral sex. So things like gonorrhea and chlamydia can live in the back of someone's throat. They give you oral sex wherever they put their mouth. You could get that same infection. If you have an infection and then they put their mouth wherever that infection is, you could also get that infection. So you can definitely get things like gonorrhea, chlamydia that live in the back of the throat, but also things like herpes, syphilis from oral sex.
And another myth is if I use birth control, I am safe.
So if you use birth control, you're absolutely safe from an unintended pregnancy, but that's it. You're still at risk of getting something like gonorrhea, chlamydia, syphilis, herpes, HIV, all of it. I think sometimes worrying about pregnancy drives a lot of women, but I don't think that that's the only thing they should worry about.
And STIs are permanent.
So that is also a myth. Most infections we can treat and therefore can be cured, but there are some infections that you don't like clear fully, something like herpes or HIV you would have for a lifelong, but other infections like gonorrhea, chlamydia, syphilis, you can treat and cure and be done with.
And PrEP is just for gay men. And we're gonna talk about what PrEP is for those of you who don't know it a little later, but is PrEP just for gay men?
So PrEP is not just for gay men. PrEP is for people who are at risk for getting HIV. So this, which we can go over, involves a number of different groups, not just gay men.
And I think a lot of folks, if my partner gets tested, I don't need to.
So it's wonderful that your partner wants to get tested, and I think that's a sign of them being responsible and taking their health serious. But you need to get tested for you. You could have something that the partner hasn't been transmitted yet, so it's important to get your own testing so that you feel comfortable about your own health and your own sexual health.
And from what you're saying, really taking charge of your sexual health. And kind of the next question, or next myth, I should say, getting tested means you don't trust your partner.
So I think if you're testing because you don't trust your partner, that's very problematic. And I've seen that a lot in my career. But it doesn't necessarily mean that you don't trust your partner. I think you should test, like, again, for your own health so that you know that you are negative, or that that you're moving forward in a safe way. I think that testing, if your partner tests, it doesn't mean that your tests are going to be negative. You may have something that just hasn't been transmitted to that partner.
And the last question before we move on is, once you're tested, you can never get an STI again.
That unfortunately is not true. There are infections that are bacterial and things like gonorrhea, chlamydia, syphilis that you absolutely can get again. You can even get reinfected with certain viruses, so it's definitely not true. You can always get another infection if you've been treated for one in the past.
And these are some common myths. There's many, many others, but the most important thing is to have these conversations. If you're unsure, it's okay to ask and engage in dialogue with professionals, folks who do sex education, because it's really important to break the stigma. And that's the one, when we leave this session today, if that's the one takeaway, breaking the stigma when it comes to sexual health and STIs is one of the most important things. So we're going to go into this next part is going to be about STIs and what people should actually know. Sure. So what are the most common STIs?
So the most common STIs, if we look at prevalence, HPV or human papillomavirus is actually the most prevalent in the population. So 8 out of 10 people will come across HPV at some point or another in their lifetime. Herpes, so genital herpes, is about 1 in 5 adults. So those are really prevalent infections in the general population. If we look at reportable infections, so chlamydia, gonorrhea, and syphilis are of the most common in that order.
And what is the most common symptoms? I mean, they're different for each one, but what are the most common symptoms or that people should watch out for?
So I think what brings patients to our clinic in particular is something that's changed, whether it be they have a new irritation or pain with urination, changes in vaginal secretions, new bumps or lumps, things that they've noticed are just not their normal. I think it's hard to say exactly what brings most patients in, but I would say one of those symptoms are definitely some of the most common that we see.
And kind of talking about coming in for a visit, what is someone, what should they expect when they come to the sexual health clinic?
So in the sexual health clinic, you would come in. We hope that you would feel welcomed. We would check you in. One of our amazing clinicians will take you to a room where it's private. We'll ask you about your general health history, allergies, as you would in any clinical setting. And then we'll get into your sexual history, your sexual practices. We'll ask you about symptoms. Do you have fever, sore throat, swollen glands? Pain with urination, discharge from the penis or the anus, testicular pain, rashes, abnormal vaginal discharge, bleeding, pain with sex, things like this, mucus around the stools. We really get into it to find out, what's going on with you. And depending on what you tell us, you could have an exam where we're looking to see signs of certain infections. We offer an array of tests, things like HIV testing, hepatitis C, syphilis testing, gonorrhea and chlamydia. We'll test every orifice, so your throat, penis, anus, vagina, whatever, any place that you possibly could be infected, we're going to test you. Those tests, and we also can do some things point of care, like we could do a pregnancy test if that's indicated. We could test you for HIV if you were at really high risk and there were symptoms. There's some tests too that look at infections in real time, like where we look at a slide under a microscope. Those tests can be sent off, and then we would, get your test results usually within a week, and then we either bring you back for treatment. If there's something that we diagnose on the visit, we would treat you right there. We kind of are a one-stop shop, so we want you to leave feeling that you've had a comprehensive visit, a comprehensive testing, and have a plan in place.
And if someone does test positive, what does happen next? You kind of alluded to it.
Yes, so if you test positive on the visit, you would be leaving with medication, with instructions, and follow-up plan. If you test positive and we have to have you treated, some things we can treat over the phone. We would call in a prescription or send in a prescription to your pharmacy. Other infections would require that you come back to the office, something like gonorrhea or chlamydia, that we have to give you an injection, for instance, then you would have to come back to the office.
And Daniel did give a plug, and I'll share with Amy and all of you how to get to the sexual health clinic and how to schedule an appointment. But, they are my colleagues, but they're some of the best. Daniel's one of many nurse practitioners, and there's someone who does data. There's some great admin support. So kudos to all of our wonderful colleagues. So what if someone comes in and they're still on their parents' insurance and they don't want them to know that they're sexually active? Is there a way that they're not on their parents' insurance?
Yes. So our clinic is a fully functioning Department of Public Health site. So we can have your entire visit at no cost to you, your tests sent to the Mass Department of Public Health, where they would be processed not using your insurance. That's a common thing that we actually have, that people are worried about confidentiality of insurance, explanation of benefits being sent home to their parents. But we have ways around that you could be tested comprehensively and it wouldn't go through that insurance policy.
So, my last question is it weird to talk about this stuff,
Definitely not. I think it would be weird not to talk about it. I think we at the Sexual Health Clinic in particular, we want people to feel completely comfortable talking about all of their sexual practices, their sexual life. I think it's a very unique moment to be invited into that person's space, like a very private aspect of their life. I think that by providing a place for them to talk about that, that's the least weird thing ever. So I feel like it would be weird not to talk about it. How can you get to a problem if you can't talk about it? So I'm a huge advocate to making someone feel comfortable enough to bring out all of their issues, all their concerns, and then we can deal with them.
And there's a question from the chat, which is it's like you're reading my mind. The next part we're going to cover is about vaccination. So which STIs have vaccines available?
So there are 3 vaccines for sexually transmitted infection. So hepatitis A and B, as well as HPV. So hepatitis A and B are viral infections that attack the liver. Hepatitis A is spread through fecal oral transmission. So you can get this from contaminated food and water, but you can also get it from things like anal sex or rimming. that vaccine is two doses over 6 to 12 months. Hepatitis B is spread through blood and bodily fluids, so it can be spread through sex. And that's 3 injections over 6 to 12 months. We're fortunate to live in a country where that's mostly part of childhood vaccination now. But if you haven't been vaccinated, you should definitely seek those out. HPV is also known as Gardasil. That's going to protect you against 9 strains of human papillomavirus. 2 of them are responsible for 90% of visible genital warts that you get on your penis, your anus, the vagina, the vulva, the cervix. And it also protects against 7 strains that are responsible for most cervical, vulvar, penile, and anal cancers, as well as some cancers of the throat. So those are really important vaccines for people to take advantage of and make sure that they're vaccinated.
And with the HPV vaccine, can someone still get the immunization if they're already an adult?
Absolutely. So recently, like a few years ago, originally the HPV vaccine was for very young girls, and it was expanded to include very young boys. And then it was expanded to include people up to age 27. Now it's been expanded further to age 45. And it's a conversation you would have with your healthcare provider to decide what your risk is of getting HPV. And, relationships change, people get divorced, people have new relationships, new sexual contacts. I think if there's any question at risk of getting HPV, you should definitely get it. The vaccine is 3 doses over 6 months in adults, and it's definitely going to save you a lot of drama in the future if you could just be vaccinated. It doesn't guarantee you won't get HPV, but it guarantees, hopefully, that you'll have some protection against some of the strains that are really important to your health.
And I just want to, someone wrote in a question about DoxyPep. We'll be coming to that shortly. So I just want to make sure we didn't miss that. So if I already had an STI, should I still get vaccinated?
Definitely. I think that you should. We take a sexual health history that includes what infections you may have had in the past, and that you should definitely still get tested for STIs. I think that you should be vaccinated against the STIs you haven't been vaccinated. It just reminded me, as you brought that up, that MPX, formerly monkeypox, is another infection that you can be vaccinated against, and that's 2 injections within 1 to 2 months of each other. And we offer that in the Sexual Health Clinic as well. So there are 4 infections.
Well, one thing is, we talk a lot about the Sexual Health Clinic. Can they also go to their primary care provider and get these vaccinations?
So you definitely can get all of these vaccines at your primary care office, less maybe MPX, the formerly monkeypox. Hepatitis A and B are part of routine childhood vaccination, as well as Gardasil, the vaccine that protects against HPV. And just like you could go to your primary care as well and ask for sexual transmitted disease testing or STI testing. But I think it's important to understand that you want to feel comfortable wherever you go, whether it's your primary care office or our office. This is what we do at the Sexual Health Clinic, so obviously we're the most comfortable I think that you could be in terms of a provider, but you want to go where you're going to get a comprehensive testing panel. So sometimes primary care might not think of where to swab, so just make sure you follow up with where you've had contact sexually, that you get tested at that site.
And you talk a lot about being comfortable talking to your healthcare provider, and we'll be talking a little bit about how do you be your own healthcare advocate. I think that right now that's really important. So let's talk about PrEP and protection, and also DoxyPep. So what is PrEP?
So PrEP is a medication. There are several options that can help prevent you from becoming HIV positive should you have an exposure. So it's meant to protect people who are at high risk from getting HIV.
And you just answered it, but how does it work to prevent HIV?
So PrEP interferes with the life cycle of HIV, and so it prevents this from replicating and would prevent it from essentially kind of taking over in your body. So if you have an exposure, it's going to stop it from replicating, so you don't become HIV positive.
So during the myths, we said that we talked about is PrEP only for gay men. So and you debunked that. So
yes.
Who should consider going on PrEP?
So people who are at risk of getting HIV should consider PrEP. And this includes men who have sex with men, whether they're gay, bisexual, questioning anything. It should include people who are transgender, people who are maybe in a discordant relationship. Maybe you're in a relationship with someone who's HIV positive. It should also include people who are at high risk, maybe occupationally, like people who work in the sex industry or sex workers. It should also include people who inject drugs because they're at risk for getting HIV. Anyone who has, recurrent sexually transmitted infections might be appropriate for something like PrEP, regardless of who they're having sex with per se. It's meant as a tool to help reduce HIV transmission in people who are at high risk. So it's like a tool in your toolbox for you to live a healthy life.
And so once someone's on PrEP, how often do they have to come to a visit?
So depending on what type of PrEP that you're on, there's an oral PrEP where we usually see patients every 3 months, where you would have testing to make sure that you're tolerating this well, and we would also test you for sexually transmitted infections. But there's also injectable PrEP that you would be seen every 2 months to have some of that testing.
And what are some common misconceptions about PrEP that you want to clear up?
So I would say that one of the most common misconceptions that stresses me out about PrEP is that everyone's on it. No, you have to make sure that you're on it. Like if everyone was on it, it would be wonderful, but that's not often the case. So you have to make sure that you're protected. Like you're taking this for yourself and not rely on other people. Like, oh, everyone's on PrEP. That's probably the one that stresses me out the most. I would also say that another misconception is that taking it off a schedule is okay. Like we have data on taking this as prescribed, and that's where it's the highest efficacy you're going to have, like the most protection you could get from it. If you take it off that schedule, it's going to drop that efficacy, and it might not be protective at all. I've heard people taking it like once on the day of, and they think it's going to work as if it's a condom, but that's definitely not the way that works. So that's, I think, a common misconception.
And one question that we have is, when you're taking PrEP, how harsh is it on your liver?
So it's actually not so much the liver as it is the kidneys, and this is particularly with oral PrEP. And so most people who take PrEP tolerate this very well, but we have a kind of set schedule of when to test the kidneys. Some people who test really well at the onset before they ever take PrEP, say their kidneys are stellar like a 20-year-old, we might only test their kidneys every year because it's so well tolerated, where other people, we would want to test them every 3 months to make sure their kidneys are still tolerating it well.
And a few more questions from the wonderful folks watching. Is PrEP available for people assigned female at birth? I thought at first it was not.
So that's not a population that this was studied in, but if there was an indication with patients who are assigned female at birth that have an HIV risk, this would definitely be a conversation that you would have with your provider about whether or not that's something that you should do, something that you should start. So if you think of a female assigned at birth that works in the sex industry that might not have, always the control of using a condom, or there's so many opportunities, or a female assigned at birth who's in a relationship with a male who would be a person that definitely should consider PrEP.
And we'll be sharing information of some resources as well after this webinar, so stay tuned. And are there any other medications like PrEP that can help to prevent the onset of STIs on someone who is sexually active?
So there is doxypep, which is recently something we've implemented in probably the last 2 years-ish. And this is an antibiotic called doxycycline that's taken as a single dose within 72 hours of an unprotected sexual contact, whether that be anal sex, vaginal sex, oral sex, where the possibility of an infection could have happened. And it's not going to guarantee that you won't get an infection, and it's not 100% guarantee at all that it's going to have an effect, but it can help reduce things like chlamydia, gonorrhea, and syphilis. It's most active against chlamydia and syphilis, but it could be active against gonorrhea. But like I said, it's not a 100% that if you take it, you're not going to get those infections.
And it looks like there's a follow-up. Is there a credible concern of drug resistance with the use of doxy?
So that's an area that's still in study. I think that there's always the possibility when antibiotics are at a low level and then exposed to certain other infections that there could be some level of resistance that's developed. I think we'll see that over time as we continue to implement doxypep. I do think there's some concerns in the general like medical community that that's a possibility. There's also concerns about the person's own their own microbiome and how taking antibiotics sometimes frequently could affect your gut bacteria and other things. So there's definitely going to be some more area of study on this.
These are fantastic questions. Please keep them coming. So Daniel, you always talk about the worried well. Can you explain what the worried well are?
The worried well happen to be my favorite kind of patient, where they are very educated and they come in and they know all of the infections and how they might get things, but in general, their risk is pretty low. But I like to take that opportunity to further empower them to, think of what they can do to live the most healthy life. I think, if anything, our amazing team does in the sexual health clinic is we want people to think of sexual health as part of general health. Like, I strongly believe that if you take care of your sexual health, you live a better life. Like, you have better relationships, you have better interactions, you have better sex overall, because you're not so paralyzed by the fear of these infections and the fear of the stigma of having something and all these things. We want you to live the best possible life, and that starts, I think, with sexual health.
And actually, a campaign the Sexual Health Clinic did a few years ago was "Healthy sex starts with a healthy you." So, and you'll see some of those flyers around still. So, what are some phrases or questions people can bring into the room to help guide the conversation? Say if it's their first visit to the Sexual Health Clinic, they're nervous, they're worried. Well, like, how can you guide them?
So I like to open, after we go through our initial questions on general health and allergies and things like this, what medication someone's on, I like to ask them what brought them in. So what brings you in today? And it can be, this is an opener for you to say everything that you want to say. And I want people in our office to feel like they can completely, say anything and disclose anything. This is a safe space. And not only are we not judgmental, but I also think that we've, in a sense, heard it all. You're not going to shock us into something that's shameful or embarrassing at all. If you come in and you explain what your concerns are and ask about your own risk, you're winning. I think that if you don't disclose, if you withhold, like maybe you're really worried about a sexual contact you had, last night, and then you're coming in, you shouldn't be afraid to say, when was your last sexual contact? Last night. If you said waiting room, we wouldn't even be shocked. So it's like, we want you to feel, open to be honest, and in a way that helps us better work with you, better, serve you in a way.
And say if someone had a really bad experience with their healthcare provider, what advice would you have for them?
So I don't think one provider should scare you away from getting health care at all. I think that that's unfortunate. I think it happens probably all too often that people are, I don't know, maybe shamed or, made to feel embarrassed about something. I think that you should try to seek care where you feel supported. And the sexual health clinic, I mean, we have a wonderful clinic, as you've heard us say at Mass General, but there are other clinics in Boston, if you didn't come to us, that also specialize in sexual health, that you could also seek care. I think that you shouldn't let one provider deter you from getting, the testing that you need, getting treatment that you need, feeling that you're plugged into this area of your health.
And kind of quickly going back to PrEP, do you ever see people hesitate to ask for PrEP for fear of being judged?
I have definitely seen some people fear asking for PrEP, and I think it's because they almost think that they're like priming themselves to like go hog wild, but that might not be the case. I actually think we should think of this as providers as a little safety net. So I still condoms on PrEP because you're HIV, there's still gonorrhea, chlamydia, syphilis. Infections are percolating, and so it's really condoms are still used. So I think people who are afraid to ask for PrEP maybe think that they're going to be judged, that they're going to go condomless crazy. So that's not what we think. In fact, I try to always think of this as the person's asking for this safety net, and it's the same as any other safety net. It's another tool in your toolbox to help you live a healthy life.
We're about to go into some questions that we've asked some of our community partners and some of the community events we've gone to. And again, please keep the questions coming. But what STIs are on the rise right now?
So we're actually seeing record historic infections of syphilis, congenital syphilis, which is where the mother is transmitting this to the baby. We're seeing a lot of increases in gonorrhea, chlamydia. These are mostly in certain populations are adversely affected, like in men who have sex with men, you might see more like syphilis and gonorrhea, but they're all on the rise, like syphilis, gonorrhea, and chlamydia.
So we're going to go into the some rapid fire questions.
Sure.
So how often should one get tested?
So we get this a lot. This is probably one of the most common questions from patients in our clinic, and this all depends on your activities. So if you're very active with multiple partners over weeks to months, I think you should be tested more frequently. Some of those patients that fit that category might come in every few months. If you have fewer partners and your general risks are low, then I think it could be annually or twice annually. I mean, it really depends on your activities. I think too, if you're always using condoms or if you're not always using condoms, that might warrant you coming in more frequently. And you should definitely always come in if there's a concern about anything, an exposure to something that you're worried about, if you develop symptoms that you're worried about. Nothing should prevent you from coming in to get tested.
So say someone comes in and they get tested for HPV, and should they start panicking at the disco?
Oh, definitely not. So something like HPV, think about this. In a room of 10 people, 8 of them are going to come across this virus. So this is out there, and if you tested positive, there's definitely some follow-up that will happen with that, but you definitely shouldn't freak out. There's the good thing about these infections is once you identify them, you can like deal with them, and have a plan and treat things and follow up with things. Not knowing is the real problem.
And one question that came in, I love this question. Should older adults be concerned about getting an STI?
Definitely. So we see a lot, I think there's somewhat of a sexual awakening now with some of these older adults. So I've seen patients in our clinic, like in their early 80s even, they're still getting tested. We have people on PrEP in their 70s. So it's like older adults are definitely sexual beings. And I think that's a common misconception that they're not. So I think any sexual activity, you should get screened. So older adults definitely should be, concerned about infections and get screened.
Wasn't there a documentary, I think, about the villages in Florida that they had the highest STI rates in the country for older adults? So you alluded to this, but I think it's good to like drive this point home. And can I take PrEP and still use condoms?
So definitely, I think PrEP is your backup plan for if you're at risk for getting HIV. Like maybe you got caught up in the moment and didn't use a condom. Maybe you were a little bit drunk and didn't use a condom, or high and didn't use a condom. This is like your backup safety net. That's how I kind of see PrEP. But condoms in general are wonderful at protecting against HIV, gonorrhea, chlamydia, when they're used start to finish and properly. So I think the two of them, you're going to be really protecting yourself, together.
This kind of goes back to one of the myths we talked about earlier, but is there a discreet way to get tested if I'm worried about insurance or privacy?
Yes, and this is what I talked about. In our clinic, we're a Department of Public Health site, so we offer testing for HIV, hepatitis C, gonorrhea, chlamydia, syphilis. vaginitis. We have all of our medications on site. You can get tested, treated, all of this at no cost to you through the Department of Public Health, so you wouldn't have to use insurance. Patients who have insurance can use insurance, and we encourage people to use their insurance. But you definitely can get tested at no cost and without using your insurance through the Department of Public Health.
And how do I tell a new partner that I've tested for an STI before?
So I also get this question a lot in the clinic, is how do you bring up these things? Starting new relationships, and it is difficult. I like the person to take their visit and their screen and kind of use that, angle that in as a way to bring it up with their current partner, to be like, so, today I got tested, I went to the clinic. Like, when was the last time you were tested? I think it's just an opportunity for you to talk and to open up this conversation. I don't think that people necessarily need to scream from the hills that in 1992 they had chlamydia. But I think that if there's things that you're worried about, like I have type 2 herpes, these are real conversations that you should have with a potential partner, so that they can make educated decisions too. So I think bringing up, testing and encouraging that person to get tested and just to start that conversation about, sexual health will help you find a way to, bring that up and notify that partner.
Now, true or false, is herpes included in regular STI screenings?
So herpes is not included in routine screening for a sexually transmitted infection, and that has a lot to do with prevalence. So there's two types of herpes, type 1 and type 2. Type 1 is usually associated with oral lesions, like what people call cold sores or fever blisters. And type 2 is traditionally genital lesions, what people call genital herpes, but they're interchangeable. So half of the population-ish have antibodies against type 1 herpes, where about 1 in 5 adults, like I mentioned earlier, would have type 2 herpes, like genital herpes. The two ways to test for herpes, one would be that we would draw antibodies on you to see, do you have herpes? Like, have you ever been exposed to herpes? Those tests, that the antibody test is only good at a look before the last 3 months. So it wouldn't capture any potential infections in the last 3 months. And it also wouldn't tell us, where is the infection? Is it on the mouth? Is it on the penis, the anus, the vagina? If you had symptoms for herpes, like a lesion on your penis, on your vagina, on your anus, that testing would be, we're going to swab that site and send that off for herpes. And hopefully it would tell us, is it herpes? And then what type of herpes is it? You can get type 1 herpes if someone rimmed someone else and they had a herpes on their mouth. That person could get type 1 herpes on their anus. And then that would be anal herpes, but with type 1 infection. The reason why it's not part of our routine screening is, unless you had symptoms, we wouldn't be swabbing it. You'd have to have a manifestation of this infection, like an ulcer, a bubble, a slit, a sore, something like this for us to swab.
And we have a couple more questions from people who submitted before, but again, please feel free to keep the questions coming. Is it safe to get tested during your period?
So it's safe to get tested during your period, but I think in general, we wouldn't be, if you had symptoms, we wouldn't be able to perform a pelvic exam on you easily if you were menstruating. The swabs that we use for gonorrhea and chlamydia, they are very sensitive to those infections within only a few days, like a couple days of being transmitted, those infections. But it might be helpful to be off your menstrual cycle so we collect enough of the vaginal secretions to make those tests more accurate.
Are there any apps or sites you recommend for tracking, testing, or partner communication?
So the Department of Public Health has some app in the works potentially to notify partners. I've heard of other apps like Grindr and things like this that might do an anonymous notification that you've been exposed to a sexually transmitted infection. The Department of Public Health already has, and it's been in place for literally decades, an anonymous partner notification. Say like syphilis, you could have in fact, the Department of Public Health would proactively contact you to see if you wanted them to anonymously notify your partners. And they wouldn't be like, you've been in, Daniel says that you gave, like he has syphilis and do you want to get to, this would be like they'd call that person and say, there's someone that you had sex with in the last 5 years or whatever, potentially had syphilis, and you should get tested. It's very, but they may not give any time frame. So it's truly an anonymous notification.
And one final question from the community is, can I get STIs from sex toys?
So this is an interesting question. So you can get some sex toys. Sex toys can be a little reservoir for some infections if they're used between two people at the same time. A lot of these survive on objects like toys for very long once they're exposed to the environment. But if you were to use this with someone, so if someone had, chlamydia in the vagina and two women were sharing that, the other one's definitely going to get chlamydia. If someone had was using this on their anus and then someone put it in their mouth at the same time, however gross, some may think that's possibly could transmit something like gonorrhea if the gonorrhea was in the anus. But in general, most people don't think of these things as transmit, but they could transmit certain infections.
So before we go into final takeaways, and if anyone has any more questions, what is one piece of advice you have for someone coming to the sex for the first time and they are worried, panic at the disco? What advice do you have for them?
So my advice would be take a breath. We are going to work with you. We're going to listen to you. We're going to listen to your concerns. We're going to give you the most thorough screening to make you feel better. We're going to drop that anxiety down. We're going to leave feeling better about the whole situation. Whatever happened in the past, we're going to work with you. There's people can arrive in the most like dire, situations and they're dealing with the anxiety, and we can dial this down. We want you to feel comfortable. This isn't an in and out type of visit. Like, we're gonna work with you, we're gonna take our time, and we're gonna get to whatever it is that's bothering you.
And final question is, what are 3 key takeaways, everyone watching, what are 3 things you want people to leave this conversation with?
I would say that sexual health is part of general health, and that you should treat this as you would your general health. Getting a flu vaccine every year. Sexually screening for sexually transmitted infections should be seen the same way, honestly. I would also say not to shy away from your sexual life, and not to be ashamed of anything that you do. I just mentioned putting a toy in someone's anus and then in your mouth. We encourage people to just live their sexual life and not feel embarrassed by these activities or feel shame. So that's another thing, is it goes against our culture, I think, in general, to that sexuality is something to be hidden or something to be private. And to an extent that is true, it's like truly yours. But I feel like if you're able to share that with your provider, you can really get to a place where you're living a really healthy life. Like, that part of your life is a healthy part of your life. And then the third, definitely get your vaccines. I think that's your best option to prevent at least, some of these HPV infections, if not hepatitis A and B. I think that's really important, or MPX if you're appropriate. So I think those 3 things, and as a side, just to get tested. There's this is available to you. There's options for you, if you don't have if you're underinsured or uninsured. I mean, you should come in and see us if there's a need. Don't wait. If you have symptoms, come in, don't wait.
And if people want to schedule an appointment with you, where would they find you?
So we are the clinic, the Sexual Health Clinic at Mass General, is located in the Cox building on the 5th floor. You can call 617-726-3236 and schedule an appointment with me or any of our lovely NPs. We will see you. We have clinics Monday through Friday. There's also a Saturday offering. There's a couple evening clinics. We see some patients over in Chelsea, so there's tons of options for you to come in and be seen.
Well, Daniel, it was a pleasure as always to chat with you, and I learned some new things today as well, and I hope the folks watching did as well. So I'll turn it back over to Amy.
Thank you so much, Daniel and Eric. This is extremely helpful for the opportunity to raise an awareness on such an important topic. I also included the web address to the MGH Sexual Health Clinic. So for more information, feel free to visit their website. And for everyone joining us today, thank you so much. Hopefully you found today's session helpful. As I had mentioned, today's session is being recorded. It'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you, everyone.
Thank you.
Take care.
Bye.